Okay, so now let's go back to the pupil. I jumped the gun a little earlier there. But what we have here are the sphincter pupillae and the dilator pupillae. And by now you should know what that term dilate means, right? So dilate means grow bigger in diameter. The sphincter pupillae, just like those sphincter muscles, again, when muscles contract, they shorten. So if the sphincter pupillae, this round muscle, contracts, it's going to shorten. And when you shorten something, it's like pulling a drawstring. It's going to constrict. Now, what do we see here? Our old pals, sympathetic and parasympathetic. So what happens is that the dilator pupillae, what are they going to do? Well, notice that these fibers right here, or actually in the previous picture, notice that these fibers are running, again, from the inner diameter towards the outside. So they're kind of radiating like the spokes of a sun. So when these constrict, what are they going to do? They're actually going to pull things toward the outside. Okay, so remember, sympathetic, that's like when you're encountering these intense situations. And remember, what does the sympathetic nervous system do to your pupils? Remember that scary dark place? And then what are you going to do in a scary dark place? You want to let in more light. So this is why your pupils, they grow bigger so your eye can get more light towards the back of its retina. So what you have are all those muscle fibers in what we call the dilator pupillae. So these run like spokes of a wheel, and when they constrict, what are they going to do? Well, their origin is all around this outer periphery. Their insertion is over here. So remember that insertions pull toward origins. So when these constrict, they're going to pull this, and as they pull this, this ring right here is going to draw this ring toward the outer perimeter right here, and thus dilate and expand this pupil. So this dilates. Why? Because again, these muscles all around the eye are pulling the pupils toward the outside. Now, what does parasympathetic do? Well, instead of innervating the same muscle, it innervates a different muscle. That's the constrictor, that sphincter we talked about. So remember, sphincters, when they constrict, muscles, when they contract, they grow shorter, right? So if you make a ring like shorter and shorter, it's going to constrict it. So this is how your pupil is able to constrict after you've done, when you're in a dark place and you want to constrict your pupils again after having it dilated due to sympathetic activity or low light, you want to constrict again. So that's when the parasympathetic activity takes over. All right, so let's talk a little about parasympathetic pharmacology. So with anticholinergics, remember previous lecture when we talked about parasympathetic neurotransmission, we saw acetylcholine at both the preganglionic and postganglionic neuronal synapse, and we also saw acetylcholine between the postganglionic neuron and the target tissue or organ. So what happens if you have anticholinergics? Well, they're going to counter the effects of acetylcholine. So these are the drugs that block the effects of acetylcholine. And anti-muscarinics, okay, so remember that at the preganglionic and postganglionic synapse in both sympathetic and parasympathetic, you have acetylcholine and you have nicotinic receptors. But where do you find muscarinic receptors? You only find them at the synapse between the postganglionic neuron in the parasympathetic nervous system and its target tissue. So these anti-muscarinics are going to block that receptor. So these are muscarinic receptor antagonists, and this includes things like atropine. And this is actually very interesting because it actually was originally derived from a natural product. This is the belladonna plant, or also known as nightshade. So this is a poisonous plant, but if you extract this chemical and give it at the right dose, it can actually be used to block parasympathetic activity when you don't want it. So your gastrointestinal tract is actually, again, under the control of your autonomic nervous system. So if you're doing surgery on the gastrointestinal tract, well, maybe you want to slow down the movement of the gastrointestinal tract so it's not moving around while you're doing a medical procedure or surgery. So that might be another reason. Now, the other thing is that it has a lot of side effects. And what are these side effects? So things like dry mouth and things like pupil dilation. So actually, they don't use atropine for at the optometrist. That's what my optometrist tells me. He says atropine is too powerful. But they used to use it, and again, what is it going to do? If you're blocking the parasympathetic nervous system, which normally constricts it, well, what takes over? The sympathetic nervous system is going to take over and dilate your pupils. And things like, they used to have, yeah, ophthalmic solution, but I think he said, yeah, if he used that on for his patients, then it would last for hours. And I think, yeah, so now they use tropicamide instead. Now, remember that acetylcholine is also a neurotransmitter. So there are other synapses in your brain that also use acetylcholine that are independent of I shouldn't say independent, but they're not necessarily involved with the autonomic nervous system. So if you're starting to block neurotransmission in the brain that uses acetylcholine, this can lead to some of the symptoms of drowsiness as well. And where else do you find acetylcholine? Think back. Think back to exam 2. Think back to the very first neurotransmitter you learned this semester. Remember the neuromuscular junction? What neurotransmitter does it use? It uses acetylcholine. So if you use an anticholinergic, what is that going to do? That's going to block the effects of acetylcholine on skeletal muscle. So that's why you often find a lack of coordination if you have or this is a side effect of these parasympathetic drugs. So if you take one of these parasympathetic drugs, they might tell you, hey, you shouldn't be driving because, again, why? If you're affecting your skeletal muscles and your neurotransmission, well, maybe they're not going to contract as strong or be as responsive to motor neurons.